So today we're going to talk about lung cancer. Lung cancer is a type of cancer that starts with the growth of cells in the lungs. The lungs has two sponge-shaped organs in the chest that control breathing. Symptoms of lung cancer include coughing, chest pain, and shortness of breath, and coughing can become more severe and wheezing can occur. In China, there are 1,060,584 new lung cases. In US, there are 22,633 new lung cases. And in Japan, there are 13,623 new lung cases. Every year the lung cases amounts are increased. Based on the most recent data available, in US 2021, there were 29,500 new lung cases reported, and in 2022, there are 1,888 people died from lung cancer. Nationally, there are only 27.4% of cases are diagnosed at the earlier stage when the 5-year survival rate is much higher. Although lung cancer sounds horrible, it is not unconquerable nowadays, thanks to the development of modern medicine and technology. In this article, we will discuss one of the crucial therapies, chemotherapy. Chemotherapy is a form of treatment. For example, many chemotherapy drugs kill cancer cells by causing damage to DNA. Killing cancer cells with chemical drugs suitable for advanced, recurrent, or metastatic lung cancer can relieve symptoms and prolong survival, but there are significant side effects, of which infusion pump, chemotherapy drug pump, hemodialysis machine, CT scanner are chemotherapy's equipment, and also alkylating agents, antimetabolites, antibiotics by plant actors, platinum compounds, and targeted drugs are all chemicals for chemotherapy. Chemotherapy is the main treatment for lung cancer patients, and chemotherapy needs to be carried out for many times. This method may interfere with the patient's immune system. It will make the body immunity decline and also lend to patients susceptible to respiratory tract infection. So one positive impact of method is social. Decrease the death percent, let more people live in the earth. So chemotherapy can kill the lung cancer cells. Chemotherapy can kill the cell by using chemical drugs to kill or inhibit the growth and division of cancer cells. This can help to control lung cancer's progression and also increase the patient's living time. Second is improved life quality. When the patient got lung cancer, they will have pain, difficulty breathing, and so on. However, chemotherapy can decrease their behaviors, so it can also increase patients' life quality. As a result, to decrease the death percent. For example, there is a patient's experiment. Police officer 1 was diagnosed with advanced colon cancer with many intrahepatic metastases 13 years ago. He had to chemotherapy and treated therapy and lived 11 years longer than the doctor expected. He just felt when he do the chemotherapy, he thought that there is some hope. Second example is there are many patients with non-Hodgkin's lymphoma were treated with the chemotherapy. And also their disease was being controlled and their life quality goes upper and upper. Such as there is a 60-year-old female patient after diagnosed of the stage 1 no-Hodgkin's lymphoma through the chemotherapy. The left cervical lymph node was significantly reduced and with complete tumor response and no recurrence or metastasis. So, one negative impact of method is environmental pollution caused by chemotherapy drug discharge. Residues of the chemotherapy drug may remain in the environment and cause the pollution to water quality, soil, and air. These matter may be hard to degrade the environment and produce the toxic effects on aquatic living body and soil microorganisms and also destroy the ecosystem's balance. At the same time, they will also enter humans' bodies through the food chain. So if we won't defend it, it will harm in our body, posing a potential threat to human health. There are some chemotherapy pollution environments example. See cancer drug emissions. Studies have shown that cancer drugs such as the 5-fluorouracil and are discharged into rivers and pose a potential risk to aquatic life. Also, we may eat aquatic life such as seafood, so it is very dangerous. Also, when the concentration of these drugs in the sea reaches a certain level, they may deform it or let aquatic life dead, when in turn can break the aquatic ecosystems. To summarize, smoking, diet, air pollution, and work environment may cause lung cancer. It has many therapies such as radiation therapy, chemotherapy, and also they all can cause the cell that is bad in patient's body. It will threaten life safety. We cannot have the habit of smoking, diet, air pollution, and work environment, and try not to go to the place with strong smoke cell cherish life. Chemotherapy's positive impact is it can let more people's lives save on Earth. The negative impact is if the nurse or doctor don't manage the chemotherapy's drug well, it may pollute in the sea. As the result, it will break the aquarium's ecosystem and maybe we won't have any seafood to eat. So that's all. Thank you.